Thank you very much. It's a real pleasure to be here and to have the chance to address you this morning. What I noticed yesterday in the sessions is that you are a very informed group. And so in each of the sessions, we just got straight down to business. So what I'd like to do this morning is to take us a bit out and to get us back to the primate brain that Val was talking about. Let's talk a little bit about the thinking, the planning, the feeling. The first thing I'd like to do is, though, to start with a number. Today, 2.6 billion people in the world don't have access to adequate sanitation. It's a little bit hard when we start getting into numbers like billions to know what does that mean? How do I feel about that number? I have a little idea what that feels like. But more importantly, I have a little idea of how it feels like to get access to improved sanitation. I'm from Korea, and when I was growing up in Seoul, we did not have network sanitation in the capital city of this country. We had an outhouse in the back. And, you know, it was smelly, and sometimes we didn't have toilet paper, so we had to use newspaper to clean ourselves. But in fact, it had a much bigger impact in terms of our daily behavior. I didn't want to go to visit my grandmother's house because in case we had to be there at night, I didn't want to go to the back because she didn't have lights and I was afraid I was going to fall in. But what I remember, a positive story, is that I remember vividly when the first house in our neighborhood got a clean toilet. It was clean and shiny enough that it was installed right into the bathroom inside the house. And I remember running all the way to their house and thinking and admiring that toilet and thinking, you know, this kid's father is rich. And every day we were waiting to see, okay, who is the next house that was going to get that toilet? And that's what it feels like. And this is what we're really working for here, is how can all children get that feeling? In order to do that, to reach 2.6 billion people, we can't afford to work one village at a time. We've got to radically change the way that we think about reaching scale. In the water and sanitation program, we have three concepts that we like to think about when reaching scale. The first is, how do we support ongoing programs that are operating at scale? The second is, there are gaps, but it's not gaps everywhere. So how do we target our resources to the gaps that they are in each country and each sector? And the third is, how do we let innovation flourish in this sector? So I'll tell you a story about each one of these. The first is supporting ongoing programs at scale. I actually flew in yesterday from India. Of the 2.6 billion people that don't have access to sanitation, India has 830 million of them. And in India's urban cities, there are 330 million people, of which 40 million of them practice open defecation. 40 million is almost twice the size of the population in Australia, all practicing open defecation. 70% of municipal sewage is not treated, and this causes almost 80% of all the water pollution in India, in urban India. So, the government of India has a huge problem, and they have been spending almost 26 billion Australian dollars to address this issue about sanitation. But how do you reach this when actually water and sanitation is the purview of the state governments, not the federal government? So the Indian government started to experiment with how can we make information about how cities are doing and how citizens feel about sanitation services in cities. I think in one of the sessions yesterday, you heard about the city sanitation ratings. When the city sanitation ratings were conducted in about 440 cities around India, the results were devastating. Only about 6 cities received a satisfactory rating. So you can imagine this was widely covered all throughout the media, not only in India, but it was also picked up in the Ethiopian Review and in selected global publications. The politicians in these 6 cities, of course, used it for maximum advantage. And it received really such an awareness that even the government was surprised by how effective monitoring and getting information known and shared among the states and cities could have an impact. Now, what does this mean for us? WSP doesn't have a $26 billion budget. So what does that mean for each of us as we look at our ongoing programs? And I think the lesson here is to think about how do each of our programs align or link up to the national program? What are the other programs going on? As we review and install hand pumps, as we dig wells, are these connected to the national registry so that when the wells are dug or the hand pumps are fixed, that somebody will be there to take care of the operations and maintenance? When you're providing hygiene education in communities, what are the messages and the education programs that you use, and how do they link with the hygiene promotion programs that are linked in the neighboring community by a different organization? So let's look at each of our projects in the context of the existing ongoing programs at scale. The second message is targeting resources. According to WHO estimates, 90% of total resources required in water are really for operations and maintenance, not for new investment. So how do we ensure sustainable operations and maintenance? And I think the role of the private sector is an interesting one that's coming out much more. In many sub-Saharan African countries, the sector is really looking at contracting with small-scale domestic private providers to ensure the sustainability of these services. And we know of lots of such experiences throughout Africa. And in a management contract in Burkina Faso, the sustainability of the services meant that a private operator, small scale, that would go in with a management contract would extend services by first identifying all the hand pumps that were in disrepair, repairing them fast. And in some instances, they would extend access to services by locating hand pumps closer to the investment. And of course, as the private sector, they're always trying to reduce costs. So bringing in solar panels to reduce energy costs and other types of ways. So the incentive here is that rather than looking at poor people as beneficiaries, looking at the people that need access as customers. And we're finding lots of examples of the fact that poor people are willing to engage their earning and spending power when they have this access. In Peru, we find that households are saying, you know, I wanted to get that new toilet. I knew that it was good for me, but the reason that I actually decided to install that toilet was I found out that I can get one in blue, and I'm repainting my entire house in blue. And so the poor people have opinions. And so how do we actually work with understanding what are the incentives for them to make this purchase and to sustain that service? In Tanzania, we're increasingly working with household construction so that when a new house is built, that the modern toilet is installed right as part of the house, not always as a separate segmented purchase. The $25 easy latrine in Cambodia is also another great example where suddenly the cost of a toilet went down from $100 to $25, much more affordable. So how do we actually continue to stimulate this availability of products for poor households? The third idea that I want to talk about in terms of bringing scale is innovation. There are lots of exciting innovations in this field, including using cell phone and mobile technology to monitor whether water and sanitation services are being used, as well as many innovative ways to teach, to share information about behavior change, hygiene promotion, small-scale private sector. There's thousands of innovation. But one of the things that happens in this sector is that innovations about low-cost technologies don't get a lot of recognition. Why is that? Because almost 90% of all information about innovations for low cost are done by the inventors of the technology. And so if it's a one-way, if it's a one-way information sharing, it's already difficult because you can only do it one way at a time, but also because it seems biased, even though it may not be. So even information with the best of intentions cannot always be done by the people that are actually creating the interventions. So we want to think more about